Welcome to the C. Jason podcast. I'm Susan Wong, a nephrologist at the VA Puget Sound Health System and associate professor at the University of Washington.
And I'm Julie Chotivatanapong, a medical student at the West Virginia School of Osteopathic Medicine. And on behalf of our co-authors, we're really excited to talk with you about our recent study titled Providers' Experiences Discussing Care for Patients with Kidney Failure Who Forgo Kidney Replacement Therapy.
As background, the impetus for this study was this pressing need to improve shared decision-making for treatment of kidney failure. Many providers report difficulty discussing alternatives to kidney replacement therapy, and this can negatively impact the quality of care and decision-making support they provide to patients.
So, for this study, we interviewed 21 nephrology providers consisting of nephrologists and nephrology advanced practice providers from various practice settings across the US. These participants were randomly sampled from a national group of 203 nephrology providers who participated in a prior national survey study we conducted about their experiences caring for patients who forgo kidney replacement therapy. The interviews took about an hour to complete, and then we recruited providers for interviews until no new themes related to discussing alternatives to kidney replacement therapies emerged.
Of the 21 providers who participated in interviews, 43% were physicians and about 57% practiced in academic settings. There were three major themes that stood out in the interviews and highlight how complex these discussions can be. The first big theme was the sheer inconsistency in terminology used across providers to describe care for patients who forgo kidney replacement therapy.
Absolutely. Providers use different terms at different times and with different patients. And while providers wanted to use language that showed respect for their patient's choice and was clear in its meaning, there wasn't really a consensus on which terms best fulfilled these goals. This inconsistency can create confusion and miscommunication with patients and between providers.
Indeed. The second major theme that stood out in interviews was the inconsistency in how providers define what care for patients who forgo kidney replacement therapy entailed. Some providers might describe this care for patients as the same for anyone planning to start kidney replacement therapy, just without actually starting it. They also described this care as restricted to modifying the biological aspects of their kidney disease. On the other hand, other providers might describe this care as more holistic and focused on maintaining quality of life for patients. They also describe this care as more patient-driven. This meant that therapeutic targets, such as blood pressure or anemia, might be modified or abandoned altogether to suit a patient's individual needs and goals.
This theme relates to the first theme in that some of the confusion around what terms providers might use in part stems from a lack of clarity about what these terms mean and what care for patients who forgo kidney replacement therapy should cover.
Yes. And finally, the third major theme we found was providers describe difficulty interpreting just exactly what patients truly meant when they say they don't want to pursue kidney replacement therapy. When patients say no, do they really mean it? Could it mean no for now, but maybe later? And providers describe using a number of tactics to determine whether patients would actually follow through with not starting dialysis.
And this is remarkable because it really stands in stark contrast to what's been described about the decision-making process around initiating dialysis. In other studies, patients have described having little choice but to start dialysis or starting dialysis before they were truly ready or fully informed.
And this is why I think our study reinforces that there's a real need to improve patient provider communication and a need to work towards a shared understanding of what the alternatives to kidney replacement therapy are, what we should call this kind of care, and what this care entails.
Absolutely. I think our work also speaks to a need to challenge existing norms and attitudes about kidney replacement therapy and its alternatives. So, by improving how we talk about treatment options for patients, we can be better at ensuring they receive care that truly aligns with their values, goals, and wishes.
So thank you for listening. I'm Susan Wong.
And I'm Julie Chotivatanapong. We hope this study will encourage further research and development of resources that support patients and providers in having these important conversations. To learn more, go to the latest issue of CJASN to read our full study. Thank you for joining us today.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.